What we've got here is a nature to chlorinate. Some things you just can't bleach. So the spread lasts another 2 weeks. What does all this time cost us? Bills, we gets it. No more surprises. Feels kinda stupid.
Well, he says enough is enough. BC's top cop is announcing a crackdown on partiers as the province tries to curb a rise in COVID-19 cases among young people. Our Tanya Fletcher lays out the new penalties for rule breakers.
Large house parties, unsanctioned events on our streets, on our beaches. Enough is enough.
Those words after weeks of officials first asking nicely.
We know what skills to use to do all of these things safely.
Then foreshadowing what was to come.
Starting with warnings, of course, and then getting into more severe penalties.
Now effective immediately, sweeping new penalties for scenes like this. $2,000 fines for anyone organizing an event or hosting a party that exceeds the 50-person limit.
911, what's your emergency?
Oh my God, they're partying upstairs. There's about 51 of them right now.
Okay, we're sending an ambulance with warm blankets and cocoa.
And $200 tickets for attendees who refuse to leave or follow directions from police.
So August 21st, $2,000 fines, you heard that, yada yada. Vacation rentals, gatherings and vacation accommodations were limited to the occupants plus a maximum of 5 guests. Individuals could receive $200 fines for promoting illegal events or failing to comply with staff requests at businesses. Organizers were required to keep a contact list of guests.
I think it was inevitable that stricter measures would be implemented.
Stephen Taylor studies pandemics. He says the province had to shift strategies because the soft approach wasn't curbing the rise in cases among young people.
They need to see ticketing in action, that people who host large parties getting fines, that needs to happen and be seen.
And it's not just police. The province has also empowered liquor and cannabis inspectors, even conservation officers, to enforce the new penalties. The biggest challenge will be trying to monitor private parties in people's homes.
We are asking the public to call 311 if they see anything that concerns them.
If you see people, even your friends, they want you to call 311 and tell on them. Jeez, it's like that Alvin and the Chipmunks episode. It's about being fair or being loyal.
Theodore Seville, you're next in alphabetical order, so you'll replace Simon as honor court judge.
What? I don't want to be judged! Oh. Aren't you going to eat anything? I can't. I'm too nervous. Don't be nervous. All you have to do is be fair. No, he has to be loyal. He's my brother. He's a judge. He has to be fair. Loyal. Fair, loyal, fair.
In case the fines aren't enough, a new social media blitz and yet another attempt to target the problem demographics. So what if all of this is not enough?
We'll be back in lockdown if this doesn't work.
Those words above all, perhaps the most effective way to halt the bad behavior right in its tracks.
They have to see a group across the way and then they'll just decide that, just gonna sneak over and join this party.
Sneaking over, moving your chair to the next table, or simply pushing the tables together and sitting in large groups at a restaurant.
And they'll put it something like this.
It's a thing of the past for now.
We asked them politely to, stay in their seat, and then they continued not to do so. Where you're sort of left with your hands tied a bit as to what can you do in that situation.
Michael Brennan says most diners want to follow the COVID health measures, but there's some that just won't. And Public Safety Minister Mike Farnworth says he won't be taking any more nonsense from British Columbians.
Enough is enough. Don't yell at the waiter who asks you not to push your tables together at a restaurant.
Brennan says he's worked hard to follow public health guidelines. They've even got house rules at the Heat League.
What they do is they'll move, they'll move next to the table as close as possible, and sometimes they'll even move the table, and then politely we have to go and ask them, so you can't do this.
Nashir Mawani from Jumbo Grill says while most patrons are willing to comply, knowing there's a fine in place gives him and his staff a sense of support.
all indoor pools have been closed since mid-March because of the COVID-19 pandemic. And a reminder tonight that starting Monday, masks are going to be mandatory on transit.
This is not only about the health of the region and making sure transit is as safe as possible, it is also about ensuring people can have trust in the transit system, which is vitally important.
Reps from TransLink were giving away branded masks today to help promote the upcoming mask mandate. Anyone who can't wear a mask because of medical reasons can request a TransLink branded card to show they're exempt from the new rule.
And one more thing. Other than one time at a house where I kind of had to, I never, ever sanitized. Only soap and water.
Look at your Lysol wiping. No more Big Shot riding. The economy subsiding. I think I've got a canker sore. We're needing. Look at YouTubers streaming. Look at McDonald's weeping. Biosafety level 4. My mask is shine. The billions beat for the headlines die. The Simpsons go on Homer cries for the Trump and rights, and I should really have more wine. To small businesses, we say goodbye. We then take a shot and sanitize. We don't need to wear a mask in our store. Yeah.
Transit mandate. Non-medical masks became mandatory on all TransLink and BC transit vehicles. School rules. By mid-August 2020, BC announced mask requirements for school staff and students grades 4 to 12 in high-traffic areas like hallways and buses. At the time, masks were primarily recommended rather than mandatory.
Will I die if I don't wear a mask? Did you watch Bonnie Henley? Can someone please supply a mask?
I don't remember asking you a goddamn thing.
The second wave isn't just starting. It's already underway. The numbers are clear. Back on March 13th, when we went into lockdown, there were 47 new cases of COVID-19. Yesterday alone, we had well over 1,000. We're on the brink of a fall that could be much worse than the spring. I know this isn't the news that any of us wanted to hear. And we can't change today's numbers or even tomorrow's. Those were already decided by what we did or didn't do 2 weeks ago. But what we can change is where we are in October and into the winter. It's all too likely we won't be gathering for Thanksgiving, but we still have a shot at Christmas. Together, we have the power to get this second wave under control. I know we can do it because we've already done it once before. In the spring, we all did our part by staying home. And this fall, we have even more tools in the toolbox. People are wearing masks. That's critical, so keep it up. We've got the COVID Alert app. Take the teacher who felt fine, but who tested positive after the app warned her she'd been exposed. COVID Alert meant she went home instead of the classroom. It's a powerful, free tool that's easy to use and protects your privacy. So if you haven't already, download it off the App Store or Google Play.
You're doing. Look at the lives we're living. Look at the songs we're killing. Where can I buy a ruin? Oh, these are the deadly hallows. Remember the days of Carlos. Where is Janine Garofalo? I really miss the movie star. Trump changes his mind. I hope the song ends before I run out of rhyme. With
Good afternoon. I'm Dr. Bonnie Henry, the Provincial Health Officer for British Columbia, and this is our COVID-19 update for today, the first day of October 2020.
It's Bonnie Henry, possibly not related to old Henry. Bonnie Henry, Bonnie Henry, Bonnie Henry, the Bonnie Henry. She hangs out with Adrian Dix, and she's like old Henry.
Today we have 82 new COVID-19 cases identified, including one which is epidemiologically linked, giving us a total of 9,220 people diagnosed with COVID-19 in British Columbia. I would like to start off today talking about schools. And we have, as you know, developed COVID safety plans for each school. Each school has a COVID plan.
Your comments are so good.
2 weeks ago, kids went back to school. Can't trust 50 adults gathering, but 300 little people we were fine with. Boogers under the desk and such.
So a school exposure is when a single person is confirmed positive for COVID-19, has been in the school during their infectious period. So that's a common definition that all of us are using around the province. Many of the health authorities are also determining when a cluster, if that would be 2 or more people who are confirmed positive, attended school. But every time there is a school exposure, public health contact tracing kicks into gear. There are things that contact tracers do that are a skilled set that we have developed and we're very good at. We've done it for years, and we now have developed the skills that we know to understand what type of contact puts somebody at risk of being exposed to this virus, COVID-19. So we identify who is a close contact and who isn't. So even if you have been in a school setting with somebody, you may not be a close contact. You may not be at risk of exposure yourself. Anybody who did have contact where the virus could have been transmitted has been contacted by public health. And we know that's working, and we've seen it in schools across the province.
Ever notice that an O. Henry bar without a wrapper looks like a piece of shit? Bonnie should watch it. Her wrapper is starting to come off.
Bonnie Henry, she knows all the numbers, COVID, yeah, got the cases, gotta get the app, gotta stay inside and wash your hands. Bonnie, Bonnie Henry, watch her every day on the global news.
To make sure that we are keeping our distances, that we're wearing masks. The other important things, of course, are washing our hands, maintaining our safe physical distance, using a mask when needed, and always staying home when we're ill. Had contact outside of a school setting and may be required to be isolated and may develop symptoms and have COVID themselves. But the important thing is that we're managing the school environment to prevent transmission and ongoing movement of the virus within the school. And that is the chain of transmission. That's what we do to stop every day. It's important we continue to keep our groups small, particularly our social groups right now. Stick to our safe 6, minimize travel.
I'm going bankrupt for sure. They shut down business again. Thank you, COVID. Might as well just keep CERB. Now you're paying people less. Like they didn't know. I love how they pretend they want to help but cut the funding. The Canada Emergency Response Benefit was a taxable $2,000 monthly COVID-19 relief program, $500 a week, provided by the government, eligible workers between March 15th and October 3rd, 2020. It supported those who lost income due to the pandemic, offering up to 28 weeks of benefits. My former boss, landlord, just called me yesterday to say he had to declare bankruptcy, so I've had no work for months, and now I'll be losing my home after the bank comes in and takes the property.
Appreciate your acknowledgement of a work in progress here. I wanted to ask you about asymptomatic testing. I do understand your position on whether this is useful, but for example, travelers who need proof of a negative COVID-19 test for international travel, that may be essential. The film industry has its own guidelines. We're hearing stories of a significant backlog in processing time by Life Labs. What was 48 hours is now 7+ days. Obviously, the priority is tests for those with symptoms. But my question is, should we be relying so heavily on one private processor? What's to say this isn't going to keep happening again and again, even once we catch up?
Yeah, the priority is, of course, to make sure that we can identify cases that may lead to transmission in our community, and that's what we have been focusing on, and Life Labs is an important part of our system here in British Columbia for that public priority. Life Labs had been using some of their capacity to support private testing for asymptomatic people for the reasons you say, particularly people who need to travel or have medical procedures in other places done.
But it has to do with Halloween. You said that you were taking a look at national guidelines and how families can participate in Halloween, and we spoke with people today who said they are going to go out with their children. I'm just wondering if you have any follow-up on that.
Yes, we are working on some guidance for a couple of things. So Halloween is one of them. I know that it is of particular interest for a good number of people, and we'll be looking at things like pumpkin patches and haunted houses and guidance on how to do it. I think the basics, though, will be the same, keeping it small. And recognizing that there are many people in our community right now who don't want somebody coming to their house in Halloween. So traditional neighborhoods that might usually have done a lot of trick-or-treating or having communities get together, I'm hearing from some people they're very concerned about that this year. And the role that we play, we know that if somebody has been exposed to this virus, there's nothing we can do to prevent them from getting sick if they've been unfortunate enough to be exposed to a large enough dose of the virus. So what we need to do is keep them out of the school, out of contact with others during that incubation period, which can be up to 14 days from their last contact.